Hey everyone, and welcome. We're with Denise Levy. She is a world-renowned technologist, and we have a case to share with you. We have Jim with us, and we're going to take a look at his latest findings. He was tested for poor circulation in the legs, known as peripheral artery disease. It's a disease more prevalent and deadlier than most cancers combined, but caught early. Walking is the best medicine. So that's why we have this particular podcast that we are doing with Denise Levy because we want you to get those tests early, get diagnosed, and talk to your doctor about walking as medicine. It is, as I said, the best treatment for peripheral artery disease because you can grow new natural bypasses around those blockages that may be in your arteries in your legs. So, with that, Denise, we're not here, right, to give medical advice.
Right.
We're not here to diagnose. We're just here to offer some information, some education on the terminology, and let you know what you might be seeing so you can come up with the right questions to ask your doctor so your consult with your doctor about your test findings is more productive and satisfying. So, with that, welcome to Jim. Hi, Jim.
Hi, Kim. How are you?
Good. Can you give us a little bit of a background in what symptoms that you're experiencing with PAD?
Okay, this all started, the P.A.D. episode started happening last August in 2024. And I'm an avid walker and runner, averaging about 5 miles a day until one
Like to
day,
hear that.
and I've been doing it for many, many years.
Mm.
So starting last year, I started to feel a little bit of tightness in my calf. And I thought, maybe I'm overdoing it and all that. I didn't give it much of a thought. And then it progressively got worse. And there was one day I walked about a mile. It was a walking day that day. And it got worse really
Wow.
bad, really quick. And I
Mm,
didn't think I was going to make it home. That was how bad it was. Thank
that's
goodness I had
scary.
it was scary because I'm thinking I'm not that far away from my house,
Yeah.
but I'm thinking I might have to flag somebody down to drive me home or something like that. So that's how bad the pain
Oh,
was. So I've seen vascular surgeons, my PCP told them about that, went through a whole series of tests. So there was another thing that occurred at the same time. Uh, I was feeling fatigued besides having the issues with my legs. And they discovered that I had a rare form of endocarditis.
oh,
So it's not detectable in the blood. So the reason why I'm familiar with endocarditis, that's the second time I've had endocarditis. So that's bacterial in the blood. And I had
Yeah.
to go through my second open heart surgery last October. So
Mm.
you know what they do there? They cut you open and all that. So they had to replace my aortic valve. So while I
Yep.
was in the hospital, you don't do much walking. So it never occurred to me that, I thought that was the problems walking were related to the bacterial in the blood. But once I
It's
got
so
home,
interesting you say this. Oh my goodness. I'm literally flashing back to a case we just had a couple of weeks ago with Dr. Salhanick and a patient named Benny who shared his story on our Save My Piggies episode. I mean, literally just a few weeks ago. And he had this same exact endocarditis, went in to have his valve replaced, and he started feeling some cramps, in the back of his legs, but went home. Cramps got worse, pressure sore developed, got infected, and lo and behold, he had blood clots that had developed through the course of his journey, and he had to have them removed. So this sounds awfully familiar. I mean, as you're saying this, I had to look back, just look back at your name one more time and go, wait a minute, this isn't Benny, this is Jim.
yeah, a lot of things have happened within the last year and a half when I turned 70. Around that, about almost 2 years ago, I started having Renault syndrome symptoms where my fingers get cold, my toes get cold.
Uh-huh.
So a lot of things happen at the same time, you know. And I've been listening to Dr. Lily Johnston and all that, it's probably all related. I've been seeing my endocrinologist, hematologist, an oncologist. You name the doctor, I've been to every single doctor, including a rheumatologist.
Mm.
But
Mm.
I would have to say that I did change my vascular surgeon, so the sets of data are from the newer one. He's from New York Presbyterian. I don't want to give any names out right now, but
Oh, New
he's a
York Presbyterian.
yes,
Solid
and
hospital.
and so they did the ABI testing as well as the other test back in January. And based upon what I told him, I was telling him that I felt tightening
Left.
of the calf. I felt my calves were cramping, near cramping. It was
Sensitivised.
painful to walk. It felt like it was burning.
Yeah.
So he did all these tests, and based upon the results, he wasn't exactly sure, given what I was telling him and the results. He was saying that because of the burning that I was feeling, that it could possibly be problems above the knee. Okay, so he wasn't sure, is my problem cause above the knee or below the knee? So we scheduled an angiogram, and you see the pictures right there, and that's with carbon dioxide angiogram because I have chronic kidney disease. I couldn't
Oh,
use the regular dye, so I had to. So these are the results from the angiogram taken back in April. But I have to say that once I started to have these back in January, after I saw some of the results, uh, I went online and I found Kim's P.A.D association and all that, and I read about people talking about walking, walking, walking. Before that, I would just stop when the pain was kind of painful. I just sit down and rest and do it again. But then I guess the big tip there was to, from what I heard from everybody else, walk through the pain. And it's actually working. The most I've walked without stopping, and I walk at a very brisk pace, about 20 minutes a mile. Most I've done was 3 miles without stopping. And today I did a little bit more than two without stopping, but for a total of three.
Good
So
for you.
it's
You're
great.
really persevering. You probably have grown a lot of collateral vessels, I would imagine.
Well, I think I mentioned to you the last time I spoke was that because I'm walking a lot, the bottom of my feet feel very sore and it feels numb. But I don't know if the numbness is due to it's cold outside right now, and I've been doing a lot of research, uh, and I'm thinking because I have a little swelling on my legs, both of them, that perhaps I have a case of, besides P.A.D, chronic venous insufficiency, where the veins aren't, pumping the blood back up to the heart.
Do you
Because
have
I've had
pooling? Do you have swelling in your foot,
a
your leg?
little bit, but not as bad as it was when I was in hospital. When I was in
Yeah.
hospital, they gave
Okay.
me diuretics and all that, and you just have to go to the bathroom a lot.
Yep.
But I
So
mentioned it
I want to
to
hear what Denise has to say. She's looking at some of your results. This one is your aortoiliac measurements. Can you
yeah, those
explain
look
any of this to
okay.
us, what we're seeing?
Yeah, those look fine. Anything below 3 and 5, aorta is fine. If you could go back up and show the schematic of the calves, um, because there's right calf disease. Keep going up where it
Is it
shows
this one?
no, it shows the runoff with there. Come down just a bit. I want to see, go all the way down. Okay, right there. Now on the right leg, I would have thought they would have tried to open that 90% perineal. the others are occluded at that
Yeah.
junction.
Yeah.
And also, yeah,
What
I
do you mean
think
by,
they would have benefited by opening up the 90% on both the right and the left.
well,
Um,
my doc,
because
yeah, go ahead.
if all three become occluded, you'll end up with a wound that will have to be treated. So no wounds on your feet at all.
None at this time, and
No blisters.
the doctor did go over the results with me, and he said that he could always put stents and other things inside of me to make things better. But then he gave the caveat of durability. How long would
Right.
this last for? And how many times do I have to repeat it again in the future? So he
Which is
said,
normal. Yeah.
yes. And I said, by April, I was doing more walking, and I felt that I could walk more, even though it's a little pain, but not as bad as it was before.
Okay, good.
So my choice was to either get a stent or something like that, or walk and see how I feel. And the next set of tests that I'll be doing, ultrasounds, will be in January. So
Okay.
as far as I know, I feel that I want to keep on walking, build those
Good for you.
collaterals instead of just getting another stent, because it's a never-ending thing. Because he told me that if I was his dad, he would just say, "Keep on walking, just keep on walking." So I
If you
said,
can
"Okay."
walk, if you can walk, that's great. You just don't want to be that person that is a toe step away from amputation, that if your shoe rubs wrong, you end up with a wound that's not going to heal. And that becomes a never ending battle where you're not only dealing with trying to get revascularized, but then you're in wound care 2 to 3 times a week trying to deal with infections with that.
Right,
So
right,
you
right.
just have to balance the two. We always suggest getting multiple opinions. You're definitely doing all of the right things. Walking is the best medicine. Yes, once you have one procedure, it starts the clock for the next one. It's There's no 100% cure. There's no 100% treatment out there for PAD, particularly as well, especially for below the knee. But you do have a couple of newer technologies that may not be in your doctor's hands that increase the patency in newer evidence that has been released with Abbott. They have a new bioabsorbable stent that's available for below the knee. And then you also have Reflow Medical, which has their new retractable stent, which leaves nothing behind. It's called the Spur. And we're seeing some really great results. But the best treatment still is always walking is medicine. If you do notice any sort of wound starting to appear, any sort of area that is starting to rub, it is worth getting in, seeing that vascular doctor, and understanding your options. But before any procedure, always, always, always get a second opinion from doctors that have different tools, different techniques, different philosophies. And then you can weigh the two together to see what feels to be the best option for you. But you're doing everything in your power. And it seems, right, Denise? What are the takeaways here? Keep walking. And what else?
But the 90%, if treated by atherectomy, may not need a stent.
Right.
That's what I'm thinking, is that I would like to have one of those vessels open below 50%.
You
Because
mean just like a little kiss of the balloon, a little bit of tiny bit of roto-rooting, almost tiptoeing in. A lot
yes,
of doctors, Jim, Denise brings up a good point. A lot of doctors think you need to go 0 to hero, and you don't need 100% open down there. She's just saying they could tiptoe in there, do just a little tiny kiss of the balloon, maybe remove a tiny bit of plaque in there, follow with a balloon, maybe use, let's say, a reflow device like Spur that leave nothing behind, just to cause less is more, less trauma. just eke you a little bit more. Maybe your feet might not go numb. And maybe if you do end up with a wound, it's not going to be an acute situation.
Yeah.
So it
But
might be worth just getting a second opinion to see, if that is an option for you. And then you can weigh the options and see what feels right.
just a question
Denise, am
now.
I on track?
We don't have an ABI with this, do we?
Yes, there is an ABI that I
Or
did
with,
send.
I'm sorry, I
Okay.
missed that.
Let me pull that up. It's going to take me just a second here
So I could ask a
to
question. So if we do this rotor-rooter procedure, I guess that's the way that I look at it. Is it
There's
something,
several ways to do it.
right? So is it a one-time thing, or is it something that would have to be done, I don't know, every few years or so?
It depends on the doctor and it depends on you as the patient. We have had, for example, a patient in critical limb ischemia. He's out of Indiana and he was going to get his leg removed. And for a few months, he had actually, I think he had 3 or 4 procedures. And now he's gone almost 5 years now without any procedure at all. He
Oh,
just
okay,
needed, some time to get walking and to move, grow some collateral vessels. But he still has, because the doctor went in there and he wasn't trying to bring it back to 100% or as close to 100% as he could. He said he just went in and he just kissed it with a balloon to give a little bit more blood flow to get him out of the, limb threatening stage where he was a
right,
toe stub away from amputation. You just want a tiny bit more, possibly. It's worth having the discussion with your doctor,
right,
but
right.
it is that revolving door, and you're going to have to get multiple opinions and make that decision as to what feels right for you. But
Okay,
she's obviously concerned, as I am, when you see those smaller vessels below the knee, when you're seeing two vessels, right, Denise, 100% occlusion, and then the only one vessel, that main vessel, I think it was the perineal,
Yeah,
that
both
is
perineals.
90%.
Hmm.
And she's like, gosh, it just needs just a little bit more, and your whole leg's going to be cut off. So that's what
Yeah,
she's concerned about. She's like,
okay,
yeah,
can't they go in and just open just a tiny bit, give you a
yeah,
little bit
because it
more
may
room
be a
there?
small focal lesion that may be fixable very quickly. And your ABI, it's normal, but I'm questioning the waveforms. If they're monophasic, these may be falsely elevated because you do have some kidney disease.
Mm.
yes, I do have chronic kidney disease, yeah.
And are you diabetic?
I'm diabetic. I have a low platelet count. So all these are being addressed by the different doctors that I'm seeing. Now, one thing that I've learned from listening to Dr. Lily Johnston with
Mm.
Kim was that inflammation is probably the cause of the plaque. And during the time prior to my having the actual cramps in my legs, my PCP noted that my C-reactive protein was way above normal. And we did like 3 or 4 blood tests, and the numbers were just getting high. They could never figure out what was the source of the inflammation.
Well, you had
So,
endocarditis, so
Hmm.
right,
that'll definitely help with that,
yeah.
help hurt.
Yeah,
But also, if you want to know if you have actual inflammation in your arteries, LPPLA2,
I would have done
that's
a
a blood marker.
post-exercise on this patient as well.
What's
Yeah.
that?
I would have done an exercise. I would have exercised you for 10 minutes to see if your pressures drop.
Oh, they're
Um,
going to do that in January.
oh,
Oh,
good.
perfect.
Yeah,
That that would
And
it's
be
then
all
you'll
good.
scheduled. Plus the CVI test too, the chronic venous insufficiency. They're going
Yes,
to look into that too. Yeah,
correct.
everything's scheduled.
Um,
And just an FYI, I've been seeing my podiatrist. I've been seeing my endocrinologist.
you're staying on top of
Everything's
it.
been monitored, and I'm very
Good.
proactive in checking my numbers and asking a lot of questions. So that's why I'm participating in this. I want to learn more. So
that's
Are you
great.
learning a lot?
I'm learning a lot. I just can't wait to be part. Well, I enjoy being part of this group because I'm learning so much, and I'm learning so much from all the podcasts that Kim's having with yourself, Denise, and others as well. It's
That's
just,
great.
yeah. And just an FYI, I'm a retired engineer, but I graduated with 5-year degree in engineering and pre-medicine, so I understand a little bit of what Kim's saying with the doctors and all that. So I'm trying to be as proactive as possible. Yeah.
That's
I love it.
wonderful.
I love it. Fantastic. There's another vascular surgeon if you ever want to check him out. It's actually he's at NYU's Langone Medical
Okay.
Center, and it's
What-
Dr. Todd Berlind. And just for fun, I think you would geek out with him. He has a show on Sirius Radio on the Doctor's Channel.
Oh,
And
wonderful.
yeah, so he would be just because you're so analytical, Jim, and you're really interested in learning more. He might just be fun to get a consult with. And I know he has a really great head on his shoulders. He knows everyone at the other hospitals. They all play nice in the sandbox, and so um, it never hurts just to ask. But I think you'd have a good time with him.
Okay, yeah, I'll look him. I'll Google him.
You'll Dr. Google it.
Yeah, I'll do that. Yeah, for sure.
Well, thanks, Jim, for joining us, and Denise, thank you for helping out with Jim.
Thank you.
Okay, thank you.